Thank you, Dr. Jha. Welcome to the briefing room, by the way. To your point that so many Americans can and will get this report that just came out today that 60% of Americans it appears have had COVID. The president is getting ready to ramp up his travel schedule. The vice president just caught it. She's twice boosted. Should Americans be prepared for a time when President Biden gets this? Is it just a matter of time that the president could get COVID?
I wouldn't say it's just a matter of time, but of course it is possible that the president, like any other American, could get COVID. The bottom line is he is vaccinated and boosted. He is very well protected. He's got very good protocols around him to protect him from getting infected. But there is no 100% anything. And I think the key focus has got to be we got to continue protecting the president. That's what the protocols around him are designed to do. Yeah, let me leave it at that.
Tam?
Yeah, part of the congressional funding is to potentially deal with the uninsured fund that has run out of money. What does the uninsured fund not having any money in it mean for Paxlovid? Or if someone who's uninsured gets COVID right now, what does that mean for them?
Yeah, so first of all, Paxlovid itself will be free, right? Because
they have to see a doctor?
But they have to see someone who can actually prescribe it for them. And this is one of the absolutely critical things in a pandemic is that people need to be able to access healthcare. Turns out it's also critical not in a pandemic, right? Particularly in a pandemic with an infectious disease, it's really important that people be able to access healthcare services, get the care they need. It's good for them, it's good for people around them. And so making sure uninsured people have access is absolutely critical.
So right now, what does that look like? If someone gets COVID and they're uninsured, are they able to get treatment? Are they able to get tests? Or does CVS just eat the cost? How does that work right now?
I think right now, because we don't have the funding, there's a little bit of patchwork of what is happening. There are obviously places that serve uninsured people, community health centers, others people can get care. There are still people are still going to CVS and other places that still are offering those services, but that's not a sustainable solution, right? So right now we're in this kind of middle ground where people are still getting care, but over time, if Congress continues to not fund these urgent priorities, it's going to get harder and harder for people to access care.
Kristen?
Kristen has
to be the last one too. I apologize. I'll be back soon. Go ahead.
Thank you, Dr. Jha. Thank you so much for being here. Just a couple of questions. One, can you tell us, was President Biden tested today and has he tested negative? Do we know the last time he tested negative?
I don't know. I'm not involved in the president's testing protocol, so I just don't know the answer to the question.
He was tested yesterday and tested negative.
Okay, thank you. On Paxlovid, I just want to be crystal clear because you're trying to expand access to it, but you still say if people meet the medical requirements.
Yeah.
Does that mean that Paxlovid should only be taken by people of a certain age and who are immunocompromised, or that it should be taken by anyone who has symptoms?
No, so neither. FDA has laid out a very clear set of criteria for who should get Paxlovid. Very basically, it's anybody who's at high risk of developing complications. And the FDA points to a CDC assessment. It's a long list. I can read it all to you, but of course age is important, presence of chronic diseases. But the bottom line is that, and what I am recommending to family and friends is, if you get COVID, you should see a provider and make that assessment with your provider. A lot more people are eligible and would benefit than I think people think.
And just very quickly, can you help us to understand this moment that we are in? Because on the one hand, cases are going up, particularly on the East Coast. As you have said, hospitalization and deaths are going down. But is the country in the midst of a surge?
What I would say is, we are going to see cases go up and go down during this pandemic as we head into the weeks, months, and years ahead. The key things that we need to be following are our healthcare systems getting stressed. Are people ending up in the hospital with severe illness? Obviously, are people dying at high rates? Those are, in my mind, the most important metrics. And right now, while infection numbers are rising, and of course we all want to see infection numbers coming down, the good news is, because of the extraordinary work of this administration, we've got Americans much better protected. And that means that we're not seeing a huge bump in hospitalizations. The deaths are still declining. Obviously, we want to continue tracking those metrics.
Thank you, Dr. Jha. You're invited anytime.
All right. Thank you, everybody.
Thanks, Dr. Jha.